I'm doing the first 4 slides and you're taking on 5, or are you doing 4?
You are doing through 5.
Through 5?
Yeah, because I
Okay.
start with the COVID response.
Great. All right.
Okay.
Yeah, that's fine. Yeah.
Okay.
Urgent care. If this is an emergency, please hang up and dial 911. Get trusted pediatric care from the convenience of your home via a virtual visit on our
Hi, everyone. Go ahead and mute yourself to get us started, but we are going to start here just in a second. We're letting everybody into the room. If you want to go and say hello and your name and where you're from in the country, we would love to hear from you. Go ahead in the chat.
English quality should be there. Okay.
Thrilled to see so many of the same faces and names. A strong group of leaders for family child care.
You know, I was hearing an echo when you were talking. Are we all echoing?
You are not. Thanks for testing it, Harriet. I was just hoping that that was a blip and wouldn't keep happening. I was okay there, wasn't I?
Yes.
Okay.
And it was okay when I heard you. I didn't hear an echo.
Okay, good.
I was wondering if you watch my daily video.
All right, good afternoon, everyone. Let's go ahead and get started. As I mentioned, we are thrilled to see so many familiar faces and names, as well as some new folks joining us for this, what we might be at close to the 6th session here in a series that is really unpacking and hearing from you to support us in developing content to think about what the deep supports and ongoing quality and capacity building efforts that family childcare or home-based childcare really need to be successful in our states and communities, as we all acknowledge and as leaders in this space are all really focused on what a critical piece of our early care and education infrastructure family childcare is, and how important it is that we really build supports that are tailored and unique to meet that modality of care. My name is Gina Capito. I'm a consultant with the Build Initiative, and my partner in crime, Danielle Fuentes-Johnson, is with us as well. Danielle will be jumping in later and sharing content, as well as sharing some information at the end. I'm just going to kick us off this afternoon. We have a great set of speakers joining us to really dig in more on the concept of how states are thinking about using their preschool development grants to focus on family child care. And it's such a critical piece of really thinking about how we leverage different funding streams and initiatives and do so at that systemic level and really think about the programs that we're serving in our states. Before I do turn it over to Rachel Schumacher, who's going to start us off and moderate our session, I wanted to just do a reminder that, as I mentioned, we are at our, I guess we're technically at our 5th in our series of topics focusing on home-based childcare. Just as a note, we move in and out of the framing of family childcare and home-based childcare. We do mean the same, and when we use those terms somewhat interchangeably. We acknowledge that many states have definitions of the terms, and we're trying to be as inclusive as possible. So we're not making a statement about one type of care or another in that. We're trying to be inclusive. We also are, and have heard from many of you about the efforts that you've engaged in related to family friend and neighbor care. And we know that there are some of these efforts that really are supportive for family friend and neighbor care, but we also know that there are many others that need to be developed. That will be part of our later content, will be that deeper focus on
what needed to be emphasized as we actually
But what I wanted to click and do is just highlight that across the series, all of the recordings, all of the slides, any materials or resources that we've sourced to share in response to questions and things that have come up in the chat can be found at the Build Initiative's website. And you have the link there on this particular slide, and you see the topics that we have covered. And we did start with a discussion in the first week of June where we really talked about racial equity and disparity issues in family child care, and then we moved into the series of 4 where we really started to think more about how do we understand the supports and how do we develop the right supports for family child care programs. So we are happy to make these resources available, and as things come up in the chat, if it's something that a question that you raised that maybe we do need to do a little digging to find a resource, we will then continue to put more resources out onto that page of the Build website so that you can always find the resources and things to support you in your work. So with that, I want to introduce Rachel Schumacher. Many of you know Rachel from her years in childcare, also heading up the Office of Childcare. We're happy to have Rachel with us as she's been doing a lot of work on family childcare in recent years with many state partners as well as national partners. And she's been actively working on really thinking about the preschool development grants and, as I mentioned, what states are focused on for the preschool development grants in family childcare. So with that, Rachel, take it away.
Thank you so much, and it has been an incredible pleasure to be working with the Build folks on this project over a very interesting time span. As Gina said, we thought about taking a look at the PDG Birth of 5 grants back in when they were accepted at the turn of the year, and we had no idea what kind of change was in front of us over the next few months. But bear with us, we think we have some really interesting things to talk about that are relevant for building state infrastructure, and even though the world has changed a lot in the last few months. So as Gina said, our agenda should be up in front of you. I'm just going to do a quick overview of the PDG Birth to 5 grant opportunity. We'll talk about what our findings were in terms of the major approaches that states put forth in those applications. And then we'll have I'll do that as quickly as possible because I want to get to this amazing panel we have representing initiatives going on in Colorado and in Connecticut and Oregon. And we'll have time for conversation at the end as well as some connection moments along the way. Next slide, please. So as I said, the Preschool Development Birth to 5 grants were not exclusively about home-based childcare, but we've been really excited to see that so many states took the opportunity to really include that approach in what they were doing. Next slide.
Right back like you're super annoying.
Okay, here we go. The Preschool Development Birth to 5 grants, as many of you are most likely very aware, was a federal to state initiative where the goal was to really help states maximize parental choice.
Just a moment, Rachel. We do seem to have a little bit of chatting in the background. If you can go ahead and mute all your computer, your phone, we'll proceed. Thank you so much.
Okay, and someone says they're having a hard time hearing me. I hope that's just because of the additional voice. So you have in front of you a real quick background on the Preschool Development Block Grants, which started way back in 2015. You probably remember. Originally, they were focused on preschool itself, but they were revamped to be about birth to 5, and in 2018, 46 states around the country received planning grants. And then what we're focusing on here is the states that had an implementation grant, those were just announced at the end of 2019. And we looked to see what they were doing around family child care, and that's what we're going to talk about today. But the thing to remember is that the PDG needs assessment that was required by every state doing a planning grant really asks folks in states to think about their mixed delivery system and explicitly called out home-based care as part of that system, focused on the importance of understanding where children were maybe not getting the services they needed in the states, and particularly rural areas. And so those types of things, let's just go to the next slide, please. Those types of things really focus states to find some gaps in their systems. And just before we go on to talking about some of the things that states wrote about in the data gathering that they did, I do want to give you a chance to just quickly find your state in this map if you're not sure exactly where you ended up. The states that are you can see the states that have won both a planning grant and then were lucky enough to receive a 3-year implementation grant at the end of last year. Those are the blue states. The states that are yellow had a planning grant, and therefore they have needs assessment data that could be really interesting to look at around family child care. Unfortunately, they didn't yet receive federal funds. Then there are a group of states that that received their funding the second round of states that got planning grants, and those are Idaho and Wyoming, and those states that are Wisconsin, those states that are in green. So very exciting, lots of opportunity for you to engage in your state and find ways to make use of the data that was gathered and or be a part of what's going on in the rollout. And if you're a state administrator, you might be thinking, yeah, I know all about this. If you are someone in your state community who cares about family child care but hasn't been at the table, this is just good information for you to know where your status of your state is. Next slide. So as I said, one of the things that was really turned out to be very exciting about the needs assessment that was required in the Preschool Development Grant birth to 5, which I'm now going to start trying to shorten to PDG B to 5. So I'll try to make that less wordy since we have so many other interesting things to think about. The states really had some interesting findings that even if they didn't go into the process thinking I should really focus on home-based childcare, they often came out of it or pointed to really interesting findings in their needs assessment that really made them think that they needed to think twice about how home-based childcare was integrated into their early childhood systems. And here's some examples of things that states wrote about. For example, in California, just 9% of the home-based providers who were in the quality assistance program were also in the QRIS program, and they thought that doesn't make sense because we want our subsidized kids to be able to be in a program that we are able to improve quality. So that brings questions in folks' minds. What's going on? Is there something about the QRIS system? Is it something about how we're reaching out to people? Maybe it's how the things are measured. And so these are things that percolated in the state's minds. And I think the other thing that was interesting to point out here is providers in states that were maybe participating in a system that had unintentional consequences. We'll have Oregon talk soon about their amazing initiatives. There's really been an effort to include family childcare in the preschool program. What that does on another part of the incentives, how that plays out was something states were learning about. And then we also have Louisiana, a state that is not here with us today, but had a really interesting conversation with them about Louisiana is a state that actually hasn't licensed and hasn't included family childcare systematically in their system, and they are trying to really build new and inclusive systems as a result of this data. So moving on. To the next slide. So we were talking to states, we started looking at their PDG B to 5 plans, and then the pandemic happened. And we were in the process of sending out letters, emails to people saying, could we talk to you? We have some questions about your application. And so our research was only based on looking at first on what the application said. And we started to realize, okay, we have to talk to people. So we called people and they said, I can't talk to you, I have a pandemic going on. So several people on this call probably put off talking to me multiple times, partially because of that, which makes absolute sense. And we said, okay, let's take a break. But then when we did have a chance to talk to people, we couldn't help but say, how is COVID-19 changing the situation? What are you seeing? And so even though that wasn't the focus of the paper, we wanted to share some of that information before we got too far, and then we'll have a chance to revisit it at the end, because I know we'll have a chance to revisit in a few minutes, because we know that everybody on this call is probably taking in new situations, new data, new information, new scenarios, and coming up with new ideas based on what has happened in the last set of months, both in terms of the pandemic and the risk of contracting the disease, as well as the economic impact. So when we talked to folks who were the PDG administrators in states, there are a couple really interesting findings. And they shouldn't be a surprise to many of you, especially if you've been participating in this series. Folks were talking about the importance of really having more supports designed specifically for home providers, that home providers often didn't see themselves in the guidance coming out from states about how to handle the pandemic. And they were worrying what they should do, because in fact, we learned during the pandemic that home providers were more likely to stay open, even though they weren't at full capacity, than centers, and they felt like they needed some immediate help. They were working hour after hour, and they couldn't access the PPE that they needed in order to stay healthy and safe and keep their children healthy and safe in the program. So there were a lot of conversations with the folks that we talked to about the need for the guidance and the supports to be designed specifically for the situations of home providers, for information to be translated into providers' primary languages. There was a lot of talk about the lack of infrastructure and the need for business support. When these states tried to help their providers access the federal Paycheck Protection Plan, they found out that oftentimes they didn't have the accounting records or a separate account with a bank that has a business relationship. They really wanted to address those things in the future and help providers if they were facing barriers in that space. And overarchingly, the first thing that I heard was we need better infrastructure. We need ways for providers who are typically home-based providers, who are typically working on their own in their homes, and often very much like it that way. But in a time of crisis, there needed to be new ways to support those providers at the level that they wanted to be supported. And a lot of the state folks I talked to were talking about networks and the importance of having community-based staff family childcare networks. So before I talk too much more, I wanted to give you guys a chance to weigh in on what you think is going on out there. We have had a chance to share, so if you have questions about anything I said, feel free to weigh in, but we wanted to have a moment to stop, reflect, and connect, because this is a lot of information I just shared. And you have all been going through a very difficult time too, as all of us in this country have been really struggling with issues of feeling separated and at home and not being able to even go out for your usual 4th of July activities. But when you look at your states and communities, what are you seeing in terms of how home-based providers are being impacted? And as Gina said in the beginning, we mean both. When we say home-based childcare, we mean to include the full gamut of providers, from kith and kin providers, family, friend, and neighbor, to those who are licensed and part of the subsidy system even. So really, we're open to hearing from you. Would anyone like to share any information? You can either do it through the chat box, or if you'd like to be unmuted, then maybe Danielle, you can tell people how they can do that.
Sure. You can unmute. You can go to the bottom left of your screen and you'll see the little receiver with an X through it. You can go and click on that if you wanted to talk. And I'll go ahead and stop sharing the screen for a minute. Please feel free to make use of the chat box as well.
So we were talking about the impact of the last few months on the home-based childcare community, and really opened up to hearing the thoughts of those on the call, because every community is different. This is such a community-based service, and the impact of the economy is different around the country. Anyone want to share their ideas?
Rachel,
Just
Hey, Joyce.
and I'm sharing this because I was just in a conversation this morning. I'm in Southern California, and I work with a group of family child care providers that have formed a Shared Services Alliance, and there are about 25 members of this group. So I was talking with a lady who is really coordinating the efforts of the group, and one of the big issues, beside all the ones that you mentioned on the slide, is that many of our providers are in that age group where they are vulnerable or they have existing health conditions. So it makes them really concerned about bringing children into their center. And what do they do to reduce some of that anxiety? Because they do need to bring in income, and yet the reality is that they're part of that vulnerable population.
Yes, and
That's echoed too with Natalie Vera in the chat, similar about the mental health supports for family child care providers with the anxieties about the well-being of the children in their care, their own health, the risk of their own families, financial security, very similar, Joyce.
also,
This is Kim from Ohio. And one of the things, I mean, overall, we've heard from early childhood educators who have said they feel invisible during this time and through many of the decisions that are made. But it seems from our conversations with family child care providers that they're feeling that on an even deeper level, that rarely are they called out as a part of the profession. And then even when they've been acknowledged through policies or we've had some CARES Act grants, there's requirements that are different for them. And they sense that sometimes they don't have as much flexibility or ability to define for themselves how they could best use those funds. So I think they're hearing that, you know, even during this time, they're feeling even more like second-class citizens oftentimes. It's just exasperated something that was already there.
and this is Margaret from Oakland. And one thing that we found is that with the decreased income, that providers really need the same kind of access that families need to the basics of masks and gloves and cleaning supplies and all the things that haven't been on the shelves. So we've been getting that out to them. And for those that have been stuck in the house with their children, making sure that they have materials for the kids to play and be engaged. So those are some things that we've been trying to address here.
Rachel,
Thank
there
you.
are a couple of comments in the chat box regarding their concerns about reopening and struggling with enrollment. Once they reopen, will they be able to stay open?
Absolutely. I think so. I can just reiterate again and how often I've heard that concern. What was raised first about feeling invisible. In some of the states, there have been philanthropic efforts that have been focused on home-based care, but they're few and far between. And we have heard from those foundations who have focused on that population how grateful people are, because the impact is not just that they are on unemployment, it's that they may miss a mortgage payment. You know, they're really concerned about the impact on their entire family, not just on, you know, having to be out of the center. And there's a lot of challenges for those folks to access these services. So I think that some of the things that we're going to talk about are, you know, we're obviously written up pre-COVID-19 when states were applying for this, but it turns out that many of them are things that could be ideas for states and for communities now as we're looking forward to how do we rebuild our way out of this, and let's rebuild better and stronger with systems that are responsive to all of our providers, and especially given what we're seeing as a higher demand for small settings, smaller group sizes in states, and the fact that so many family childcare providers did try to stay open, or did, it was something like a ratio. I often saw the same ratio of sort of 60% of centers closed, but only 30% of home-based care. And though it kind of varies from area to area, but on average, I saw that a lot around the country. So these providers have been kind of floating people or making it work, even though they don't have full capacity. And that challenge needs to be addressed as we move forward. So really, really hearing what you're saying about there's only so much self-sacrifice these folks should be doing. And in many cases, the way the system has been built in the past exacerbated that natural tendency of a lot of these providers to want to do anything they can for the children and families they serve, and we need to address that systematically. So thank you so much for everyone sharing their comments. Is there anything else we should talk about before I move on, Danielle or Gina, from the chat box? No? Okay. All right, well, so thank you, everyone. Let's get back to some of the ideas that emerged from looking at states that were, that did address home-based care in their PDG applications. Okay, so just a quick refresher, going to the next slide. So I told you there were 23 states that received 3-year implementation grants from the federal government. The good news is 19 of them mentioned home-based care specifically in some way that we could find in the application, and some specific initiative they were trying to do to address that population. So a handful of them did it more systematically and had many different approaches, and some of them are joining us today on this call. What we tried to do is build a little framework to explain the different strategies people were using. And to many of you may think, well, this isn't necessarily new, but I think what's interesting is where you see states put several of these things together to might try to meet providers where they are. And so the three areas that we saw most typically and tried to provide a framework to help understand what states are trying is increasing the supply of family childcare, which now is not just a matter of increasing, which we all knew there was a big decline in licensed family childcare before COVID-19 hit. Now it's also, you can look at this somewhat through the lens of strengthening and rebuilding and helping folks come back on board. The second category was around strengthening the supportive infrastructure for family childcare. Here we see initiatives around staff family childcare networks, business practices, and really looking at ways to engage providers at the community level and doing community level planning, which is a strategy being used more in some states that really like to work more through a decentralized approach. And in the third, the yellow category, were a lot of ideas states had around trying to adapt their quality improvement and professional development systems so that they could more meet the needs of family childcare providers. And this is something that someone just gave voice to before, is people feeling unseen in the system. And in these strategies, you can see that folks were looking at how to make QRIS work better, how to make professional development work better. Can they do things around delivering supports to folks in their homes or content in their homes? And the last one is very important to providers, looking at how the rate structure works for family home providers and how it could be changed to provide more incentive to participate in state subsidy programs for childcare assistance. So let's move on to the next section of our discussion, where we are going to have the opportunity to hear from some state leaders. And I'm very excited today that we have Lindsay Dornman from Colorado, we have Harriet Feldhofer and Deb Fleece from Connecticut, and Miriam Calderon from Oregon, all people who were willing to talk to me on the phone about their programs despite everything else they were doing to try to support their providers in their states during this last few months, and who are here today to share some of their expertise and just engage in conversation. What worked for them, what worked for you, what didn't work for them. That's how we all learn the best. So moving to our first section, we organized this just to highlight, I mean, these states are doing a lot of different things, just as your state may be trying some things here, some things there, but we asked Lindsay to kick us off talking about the work she's been doing around increasing the supply of family childcare in her state. Lindsay, would you like to get started?
Sure. So thank you for inviting me to speak, and I'm focusing a lot again on the work under PDG, and then if there are questions about what we're doing in response to you know, COVID and how we're utilizing some additional resources through that, I'm happy to answer those questions as well. But yeah, today I'll focus a lot on our efforts to recruit and build the supply of childcare, as well as maintain that supply. So if you want to move to the next slide. Great. So in 2019, our very savvy state legislature required the Department of Human Services to conduct a study to formulate recommendations to address declines in the number of licensed family childcare homes, as well as infant slots in both homes and centers. I say they're savvy because this aligned very well with the PDG birth through 5 needs assessment work that addressed the overall supply and demand of early care and education programs across our mixed delivery system. So collectively, we were able to use resources for both of these efforts, and we found 5 areas in which they were elevated, in which to focus on in terms of building that family childcare home supply and helping to maintain it, as well as addressing that infant supply. So the first one is really thinking about increased financial, business, and professional support for prospective and existing providers. Second is looking at increased access to training and professional development. Another opportunity was identifying new resources to support providers navigating the childcare licensing process. This process proved to be especially challenging for family childcare home providers. Another challenge that was very specific to family childcare homes is the coordination across state and local regulatory agencies to remove administrative burdens. This includes regulations set by homeowners associations that prohibited or limited the operation of family childcare homes and communities. And the final opportunity was to conduct a review of how state policies are impacting the operations of family childcare homes. And so a lot of really good information came out of this work, and it informed our strategies moving forward with that PDG implementation grant. So if you want to move to the next slide, I can talk about some of those opportunities. So we focus on several areas to address the challenges that I just spoke to before. And again, we're leveraging funds from the Preschool Development Grant to implement the following. And again, we're going to likely compound some of this with the CARES Act funding given to the state, especially as we focus on business support. So one area that we're focusing on within the PDG is really strengthening the business practices of childcare providers, recognizing them as businesses and helping them to operate as such. And so some strategies within that include partnering with the National Center for Early Childhood Quality Assurance to offer their series on strengthening business practices for childcare programs. They offer 2 tracks, one that's center focused and one that's home focused. We're a little delayed in this work. However, we're now exploring opportunities with the National Center to be able to offer this training virtually throughout the state. It is a train-the-trainer model, which allows us to also sustain this beyond the work of the PDG. One of the things that we've expedited and actually expanded recently within our PDG renewal was individualized free consultation through Small Business Development Center Network. So the network is a collaboration between the Federal Small Business Administration as well as the state government's Office of Economic Development and International Trade. This network partners with local chambers of commerce, advocacy groups, and other business supports and communities to be able to offer both training and individualized consultation. So we're actually funding this network to provide consultants as well as consultation to these consultants. So our early childhood councils will be partnering with their Small Business Development Center to inform them about licensing rule and regulations that may impact their ability to operate as a business or inform their business models. This way, these Small Business Development Center consultants can offer more information and really work one-on-one with providers to be able to educate them, help them redevelop their model in response to COVID or other challenges, and just develop some more knowledge and savvy around operating a small business. And then finally, underneath this, we're looking at developing business and financing toolkits. And so identifying best practices for both center and home childcare providers in order to, again, have the resources or tools that they can then model to operate their business. So within that, we'll be doing some calculators that allow them to identify appropriate rates for care, as well as identify resources that they can tap into in their communities for business support. The financing toolkit will focus on childcare subsidy, Head Start, the state preschool program, and other funding sources that childcare providers may tap into to have a more secure financing model for their facility. And so again, as you think about blending and braiding those sources, a lot of our childcare providers don't necessarily understand how that works. And so we wanted to provide a tool that would educate them and allow them to model some of that in their own facility. Another strategy is providing startup microgrants. So we reserved a small pool of funds that will allow prospective childcare providers, either home operators or centers, to support some of those startup costs. So thinking about health and safety requirements or licensing costs that may be a barrier for them to become licensed. We are targeting what we're calling our childcare deserts and prioritizing providers depending on the populations they serve. So knowing who are our most vulnerable populations, in many cases we expect this to be family childcare homes who will meet this need. Next is building partnerships with our state and local agencies and advocacy groups. So again, this is thinking about other agencies or groups that can provide information or resources to childcare providers. So our Department of Regulatory Affairs, DORA, actually has a grant program that childcare providers are not necessarily aware of that would allow them to tap into some funding for infrastructure. And so thinking about some of those capital costs that money is not always as readily available for. And then finally, really thinking about that professional development piece and making sure that we're offering it in a way that especially family childcare providers can tap into. So Colorado has a pretty robust free on-demand online training system called the Colorado Shines Professional Development Information System. And so we're continuing to build out this system. We're offering trainings in multiple languages to really be responsive to the needs of providers. One of the focus points for the next year within PDG is thinking about children's social emotional development and access to mental health supports. And so how do we build training that's responsive to that, that again, providers can access at on their timeline and for free. So before I move on to my next slide, I just want to stop and see if there's any questions regarding our family childcare home supply.
Can you mention more about the home visitation for
oh, yes. Yes, definitely. So I apologize for missing that one. So in 2019, under the initial grant, we began a pilot program that would offer the HIPPY and Parents as Teacher models in childcare settings, home-based childcare settings. And so we utilized sites that were already serving families, and we prioritized rural communities. But if they're already serving a family, then connecting that home visitor and those services to the provider as well. The intent of doing this was really to do two things. One was to make sure that childcare providers had access to the same information that the families were receiving, and had additional supports to really build competency around child development. So thinking about some of those topics covered within those models, you know, helping support challenging behaviors, again, best practices around child development, child health and safety, making sure that those providers had access to that information. Within that first year, we served about 43 home-based providers, both licensed as well as license exempt providers. And that impacted about 230 children through that pilot program. We're continuing that this year, and we'll be conducting an evaluation to be able to share out whether or not that was beneficial to the home provider in addition to the family. I think one of the unintended benefits of that has been seeing a really strong connect between providers and families and really increasing that relationship and engagement among both in the development of the child. Great. So I think I'll move on to the next one, unless there's another question.
Nope, go right ahead.
Okay. Great. So those previous strategies really were focused on our licensed population of family child care home providers. However, we also have a focus in our PDG grant for license exempt or informal providers. So in Colorado, as in other states, we know that due to the availability and affordability of licensed child care, some families rely on informal child care options, and for others, it really is their preferred child care setting. So recognizing this and hoping to better engage informal child care providers, Colorado expanded its child care license exemption in 2017. This exemption allows for individuals to care for up to 4 children, no more than 2 of which are under the age of 2, without requiring a child care license from the state. This exemption was recently renewed by our state legislature and now includes additional requirements to ensure parents are informed about the differences between licensed and license-exempt care settings. Our informal providers within the state do range in levels of knowledge and sophistication, and so we have neighbors who fill in for a few hours a week to individuals who have their child development associate but cannot open a licensed facility because they choose either to operate under the exemption or because of regulatory barriers that prevent them from becoming licensed, such as immigration status. So through the state's PDG, we recognize this, and we want to make sure that we're supporting all of these environments. And so we have some strategies that really are targeting that informal care population. So again, talking about the startup microgrant, we really do want to engage child care providers who are currently operating under an exemption or informally to partner with the state to become licensed. And so we're really hopeful that those individuals will consider the startup microgrants as a resource to become licensed. Additionally, the home visiting pilot does impact our informal or license exempt family child care home. So as I mentioned before, we described that program that is expanded to this population. The on-demand online training, the PDIS, is a tool that we're hoping that more informal caregivers will begin to utilize. So as I mentioned before, we are trying to translate more of those courses, knowing that that's one barrier to our informal providers accessing that, but we're also trying to work with community partners to increase awareness of this resource. So we're not limiting who can access this. We really want it to be a resource for everybody who's caring for young children. Colorado has a model of an early literacy program called Growing Readers Together. So within PDG, we're actually augmenting this program by providing additional staffing. What Growing Readers Together does is it partners with the state library system. So there's a number of libraries across Colorado, largely in rural communities, who offer programming and training to informal caregivers. So again, they're seeing everybody from grandma to the neighbor to somebody who's more operating in a more formal capacity, coming to the library to receive these supports. Often they'll even supply them with equipment that they can take back home and work with the child with. So within PDG, again, we were able to help expand that program by providing 3 additional staff. Another thing that we're really excited about is, and I think is really timely, is an increased access to mental health consultation. So currently Colorado has 34 mental health consultants across the state. However, they are prioritizing licensed child care settings. And again, because we only have 34, we don't have a lot of access to those individuals. So we're actually setting up a warm line through the PDG grant that allows anybody who has concerns about a child's development, whether you're a licensed provider, an informal provider, or a parent, to call in and receive support. And then finally, we're just developing some resources, including a school readiness handbook and a resource hub website that's designed for both families and informal caregivers to support the overall development and school readiness of young children.
Great.
And with that,
Thank
you
you.
can take additional questions. Yeah.
Thank you, Linda. You have a lot of different things going on. In the interest of time, please put your questions in the chat box and we'll have a chance to, our wonderful facilitators will help push those back into conversation as we go. But we do want to move on and have a chance to hear from all our panelists so we can all talk together. So next we have Harriet and Deb from Connecticut, and they are going to share some of the work that they are doing around family child care networks. If you go to the next slide, I can just to go over that some of the strategies that we saw in the paper around the country for the 19 states included networks. That was very, very popular as an option. The business supports and practices piece, and then engaging at the community level. States like Virginia, Kansas, they are finding ways to put money out to their communities to do planning together and making sure that home-based care is part of that process. But we're going to today talk about family child care networks because they are such an amazing way to sort of organize the array of different services that you might want to be available to home-based providers. So I'm going to turn it over to Harriet. Are you first, or Deb? Whoever's first can get going and start explaining your model, what you're doing in Connecticut to really go statewide with family child care networks.
Great, it's Harriet, and I'll kick it off with the first slide. I think is there one before that? An introductory slide?
Yeah, I think the one you're thinking of with the shared services is next.
Well, there was one that was actually a visual of a baby.
Oh no, a visual of a baby. I don't remember that, and I would love to have a visual of a baby anytime in here whenever I'm having a policy conversation. Unless Danielle and Gina can think of it, I don't remember seeing that one.
Okay, I'll just start talking. That's okay.
Yes, start talking.
So in Connecticut, we actually began this work when we were preparing our 2016-2019 CCDF plan. We identified a large gap in our state, and it was all about the babies. We were not providing enough access and quality of infant toddler care. So we actually used our quality funds as part of our CCDF state plan in 2016 to begin this work in Connecticut. And we chose 3 strategies to, yeah, this doesn't match up with this slide, but that's okay. We chose 3 strategies that we wanted to really target for providing support. First, we wanted to target fiscal training. We realized that family child care programs were really struggling financially. They were isolated from PD and technical assistance. And so we really wanted to help them sort of get a better sense of their business practices. You know, we found out that family child care providers don't see themselves as business people or a business practice. They just love taking care of children. So we started with the fiscal training. A second area that we thought was important was around pedagogy and curriculum. So we actually participated in the PITSI. You might be familiar with the Program for Infant Toddler Care Training. And that was developed by West Ed and the California State Department of Ed. It's a relation-based curriculum that actually has several key principles that we found were important for Connecticut. One is aligning to continuity of care, cultural responsiveness, and inclusion of children with special needs. And the third area was the concept of shared services. We partnered with Connecticut's Early Childhood Funders Collaborative to explore the development of family child care networks in Connecticut. And Deb will talk a little bit more about that in a minute. But we wanted to create alliances within these networks to support back office types of tasks, administering food, purchasing supplies, etc. Now I'm up to this slide. So we worked with a broad-based group of stakeholders in Connecticut to develop Connecticut's framework for staff family child care. It's evidence-based. We looked at the research, we looked at national work, but we really wanted to ground our work in what's going to be a small but important set of guiding principles so that as we move forward, we were really true to a couple of key concepts. And the principles we really are focusing on are on this slide. Family child care networks are located in communities. So it's grassroots, it's on the ground, and it's at the elbows of providers. We also wanted to be sure that specialized trained individuals delivered services to family child care providers. So you really had to understand and know the field, and you had to have walked in those family providers' shoes. We also wanted training for providers and follow-up coaching in the home to improve provider practice. So it was going to be a hybrid, kind of a blended coaching and training, which we know together are very, very efficacious. And then finally, we wanted to have a formal assessment process to look at the effectiveness of this consultation provided to providers. This was a new endeavor for Connecticut, and we felt that it was important to really assess what we were doing, which often kind of goes by the wayside. Implementation begins, and then assessment often comes as an afterthought. So this was important to us. The next slide. We worked with our CCR&R in Connecticut, who's also our CCDF subsidy vendor. It's the United Way of Connecticut, to release a competitive RFP in February of 2018 on behalf of the OEC. The design of our RFP and all of our work going forward was really built around a paradigm that focuses on leadership through pedagogy and business practices. And credit goes to Opportunities Exchange for this slide and for actually helping us think about this model in this framework. So we have pedagogical leadership, which includes child development expertise, classroom coaching, teacher supervision, instructional leadership, and child assessments. But that often goes by the wayside if it's not part of a strong business leadership model. And I'm sure you're all familiar with the iron triangle. You know, be fully enrolled. Make sure you collect family fees. Make sure your per child costs are calculated. Do fundraising. Make sure you have good reports on your revenues and your spending. And make sure you also are compliant with state and federal funding. So if you combine pedagogy and business leadership, you're going to get to high quality ECE. We funded 7 pilot networks, and we awarded funding in April 2018, and we've now extended it through 2021 due to COVID-19 circumstances. The purposes of our funding was to support family child care providers by expanding TA, to also offer shared service business alliances, or for those that were interested in a new shared service business alliance. On the next slide. There's beauty in flexibility, but we learned a lot, and we actually learned what we probably already knew. Networks need to focus on understanding and addressing the needs of providers, and those provider needs are going to be unique to each community. And relationship building is critical to networks participation. It's about trust. Providers do not want to turn over their finances, or for that matter, any of their programs to an entity that they don't trust. We also know that business supports are critical. Providers needed to develop their business skills. Providers need to be provided with tools and with expertise to really have that impact. We found that although community needs may differ, in Connecticut, many of them were actually quite similar. However, networks needed to address specific needs of their own community. The next slide. Now I'm going to turn it over to Deb, who's going to talk about how this work has really transitioned during COVID-19.
Hello, good afternoon, everyone. So as Rachel said earlier, and then the pandemic happened, and it was incumbent upon us to pivot. We knew that flexibility was important, but pivoting was really something different than being flexible. We needed to move not away from what we were doing, but to the opportunities that we needed to seize in order to really support programs during the COVID-19 response. And so we have begun to expand our networks to a statewide effort. We had pilot networks in place. We had, Harriet referred to 7 networks earlier. We have 5 networks operating at this point of those 7, one of them doing some different work, and one of them had really taken a pause from their provision of services. What's interesting about these networks is that they are all organized and established in a little bit different organizationally. We have a very small network called the Circle Collaborative. It's a small New Haven-based network serving providers and center-based providers. We have All Our Kin, a network you all are likely familiar with from other presentations, serving multiple communities and hundreds of providers. We have a network in a community action agency. We have a network in Danbury that is providing a lot of support to individuals who are seeking licensure as a family provider for the first time. And we have a regional education service center, a professional development hub in our state that is both a network provider and associated with the Chamber of Commerce, as emerged earlier, but also that organization, that particular network, has been able to move into the COVID response phase as a partner to help us expand to bring on 12 new networks so that we are serving providers across the entire state. This particular organization called EdAdvance is serving as the hub of our networks, helping us both financially and as a collaborative partner to organize the work. As Harriet referred earlier, we were already working with the Connecticut Early Childhood Funders Collaborative, and in a 1-month time, the Funders Collaborative worked with us to raise almost $1 million to help us provide staffed family childcare networks as a response to COVID-19. We also already had in place $600,000 in the 2020 fiscal year and another $1 million in this current fiscal year and the one to come to help us lift this work even further. We were already working with these providers around shared services. We will continue to move that forward as EdAdvance is our partner with a strong back office that will help us advance the shared services concept as we move forward. Next slide, please. So what do our expanded networks look like? These networks are all currently doing outreach to every licensed provider in Connecticut. Every single provider will receive a phone call. They will receive an orientation to the new supports that we've provided, and I'll walk through that in a moment. They will receive an opportunity to join the network, to participate in professional development, and a benefit of that joining and participation will be a free 1-year membership to the National Association for Family Childcare as a member, so that we can help them access other benefits and professional activities that will support them. Our new statewide supports include that we stood up a nurses warm line That assistance is available in English and Spanish 5 days a week. They are both available via phone as well as email, and they are delivering webinars to help providers both understand how the nurse warm line can be helpful, as well as begin to develop a relationship with those folks so that they're more likely to call in and ask questions. We already had existing in our state the Early Childhood Consultation Partnership, which is a behavioral health support that was primarily focused on center-based care, and we have expanded that service to serve family child care providers, helping providers deal with issues that emerge in their programs around behavioral health and supports for families in that area. We also have access to the Talk It Out helpline, which is mental health resources for adults, and that resource is available to parents as well as caregivers. Next slide, please. Our expanded networks will deliver professional development. Obviously, that will be virtually. That will be in the form of webinars and trainings as well as resources. It will include coaching by network staff, which links back to our framework and the need to ensure that we have trained individuals who can provide that support. And importantly, and as has come up a number of times already in this webinar, the importance of business supports, both through our shared services efforts as well as through a contract that we have established with the Women's Business Development Council. And that contract will provide access to our family child care providers for individualized assessment and customized supports, a technology incentive, some specific business development supports, and microgrant eligibility to really address the business operations side so that we can strengthen and stabilize our family child care providers. The Women's Business Development Council is a multi-year effort so that we really can provide the longer term support that we know will be needed to help providers recover and be stronger post-pandemic. We've included our website here so that you can see all of this initiative, which falls under our marketing heading of Connecticut Cares for Family Childcare. And I'll conclude where we started in the beginning, is that we will RFP again for the continuation of these services during FY22, so that these networks can continue to exist and continue to be spread across our entire state. We will think a lot about sustaining our statewide services and advancing the shared services model as we work on quality improvement. All of this work will link as we go forward in time with our other quality improvement supports, which will move programs toward NAFCC accreditation. I'm happy to take questions now.
Just one quick question for you in the chat. It was about the Nurse Association warm line. There's interest in the webinars, especially if those are in Spanish. Is there a site or a link that you could put in the chat for that?
You would find out more about that on the Connecticut Cares for Family Child Care website. The webinars that have been offered previously are posted. They are available in Spanish, and they will continue to be available going forward.
Great. Thank you so much, Harriet and Deb. What I again want to reiterate is that you have a menu of different resources that you're leveraging different things going on already in your state, like you've had nurse consultants and these things for a while, but you're making it so that it's much easier for a family child care provider to, once they join into this, really access an array of things as they might want them, as well as the fact that you are building stronger because you're really thinking about not just responding to the pandemic, but what we're really building for the long run in terms of these networks. So thank you for sharing your experience. All right, next, our last panelist, but definitely not the least, introduce my good friend Miriam Calderon, who is the Early Learning System Director in the Department of Education in Oregon. She's going to talk a little bit today about their systemic approach to really thinking about what quality means and how their quality system can be more responsive to home-based care providers. So I think we may have one more slide before I turn it over to Miriam. Can we see the next slide? Yes, so these are the different strategies we saw in the PDG applications across the state relating to best practices, content being more accessible in the home, delivering it in the home, QRIS, professional development systems, how they can work better, and last but not least, looking at payment rates. And I think perhaps Miriam is going to speak to all of these, if not at least 3 out of 4. So Miriam, take it away.
Thank you so much, Rachel. Good afternoon, everybody. I guess I'll start with just a little bit of, I think, kind of some of the context here and some other information. Our approach to really thinking about our preschool development grant in generally, and I think particularly in the area of quality initiatives, and professional development systems, was designed to complement a new $12.5 million annual investment our state was making in thinking about redesign of our quality rating and improvement system and our professional development systems really together, and thinking about how we moved QRIS in a direction that supported more supply building, continuous quality improvement, and I think as some of my other colleagues have talked about as well, business practices, I think is a big area that we understand is a need for all providers, but I think particularly when we think about home-based childcare. So we really feel like home-based care is such an important part, such a vibrant part of the system in Oregon, both in subsidy, as you see there, 56% of children are receiving child care assistance and program subsidy or in home-based child care, and also in our state kind of funded and grant funded programs, which I'll talk a little bit more about in a minute. So I'm not going to get too specific into some of the QRIS and professional development work, but I'll just say kind of a couple quick thoughts about that. One is that our state is looking at both some of our PDG work is we're moving towards adopting our NACI educator competencies as a starting point, adapting those and looking at cultural relevance, also looking at our early learning and development standards, again, with another lens of, I think, equity and thinking about cultural responsiveness. And I think as a part of that, between the state investment and our PDG investment, we'll be looking at training, associated and supports for providers to support these new kind of standards and competencies, and really thinking about the delivery systems to include family child care. This work will also involve redoing steps in our registry, and again, looking at what those support systems are, access to community-based training, in addition to degrees and credential work that, again, are supported through this new state investment in professional development and QRIS redesign. I just wanted to say how I think important and relevant a lot of this work will be, specifically for our family child care and home-based providers. When we look at our data around our workforce in the field, as we think about our registry, what our data shows is that we have a much more racially and linguistically diverse workforce certainly than the K-12 workforce. But when you look at that in accordance to steps on the registry, you see that at sort of some of the lower steps, we are more diverse. As you increase in steps, which right now really the only pathway to do that, given some of the limits of access to community-based training, is through pursuing a degree. So, by the time you get to steps that correlate with an associate's degree or a bachelor's degree in our field, our workforce looks a lot like the K-12 workforce, 80% white and 80, monolingual English speaking. So I think that these moving both our QRIS and our professional development development systems and some of the opportunities that we have through this grant, including really thinking about some of those equity issues and kind of training and delivery systems and how those work to reach our home-based childcare providers is some of the really important and exciting work, I think, including FFN and our family, friend, and neighbor providers. So in Oregon, providers that care for you can care for up to 3 children or fewer, and you are license exempt. And so again, that they are also a large part of our delivery system for our families that participate in subsidy. So that's important. I wanted to touch on, I guess, some of the other context setting here through PDG that we look to build on was an initiative that we call Focused Childcare Networks. So that's FCCH networks. So I think as you've heard about already, these are staff networks. The focus for us in Oregon has been really the targeting of providers who are diverse and or serving children who are linguistically and culturally diverse. So we have networks that are entirely in Spanish or Russian or other languages. So those providers are prioritized. I'd say with the kind of state of our system right now and where our sort of professional development and QRIS currently stand, those focused childcare networks have been targeted. The collaboration between our CCR&Rs and Oregon has 16 early learning hubs that work in close partnership with CCR&Rs and have been able to support access for providers to and the children and families that they serve to sort of other supports and services available in the community. A lot of this work has also been focused around a community of practice, really focused on supporting providers to prepare a portfolio for rating in our quality rating and improvement system. And so through the partnership that we have with Oregon State University, and again, some of these resources to be able to scale focused childcare networks, because it is some of the highest touch professional development that we're doing in our state. We are grateful to have this partnership to help us understand kind of what are some of the really important elements of staffed family childcare networks. What are we currently doing that we want to continue to do? Where are some kind of areas for improvement, especially as we think about, the understanding in our field about more kind of effective communities of practice, and to support less of an emphasis on rating in a portfolio, but more on kind of support for best practices. And then last, I'll say that, as I touched on before, family childcare is a big part of sort of our publicly funded grant contract funded programs in the state. So Oregon, again, has a very strong point of view, which I think is a real strength in our state around a mixed delivery system of providers and choice in the community. Currently, for one of our state pre-K programs, Preschool Promise, we have about 20% of our slots funded in family childcare. We are just implementing and kind of in the middle of a really incredible expansion of state pre-K in our state, about 2,000 new slots beginning this fall. New slots across our state in Preschool Promise. And so as we've looked at that expansion, we have set targets for a mixed delivery system in each of our hub regions. As we thought about allocating slots, I think it's just sort of interesting to point out that, we don't really have a great way to say, okay, well, what is a mixed delivery target other than, we know we didn't want to go any less than where we were in terms of 20% of the slots being kind of in family childcare. But, I think we're always looking at that balance. And I think its work will kind of continue to evolve and thinking about how many slots need to be present in, family childcare versus Head Start versus school-based versus childcare centers. So that was very much at the top of our mind as we thought about this expansion. I think I just saw a question about whether our funding for state preschool is on the chopping block because of COVID. It is not right now. I'm really excited to report that was funded through a new dedicated tax. And so it is somewhat, it's protected, I guess you would say, than regular sort of state general fund. I think that said, it has really been, I think, the leadership of our governor, who has been really clear that, you know, we are not raising the revenue that we hope to through this new dedicated tax. And so our governor has been committed to making sure that we kept the funding for this exciting early learning expansion. It is a corporate activities tax. So I just saw another question. I hope that's okay. I'm just answering the questions as I see them fly them in the chat box.
It's great. Most people can't do that, but I'm glad that you're able to do that.
so let me dive in a little bit more specifically into some of the work that we have underway right now. So I wanted to mention first is some of our projects in PDG that are specific to quality support in childcare. So one is we are using our Preschool Development Grant dollars to fund the implementation of statewide of the SQL tool. So hopefully folks are familiar with SQL. I'm going to look up the name right now because I can never get the full name right, but it is, if you're not supportive environmental quality underlying adult learning. It was developed by the Center for the Study of Childcare Employment, and it is going to help us. It's really a survey instrument that will administer to our workforce, you know, our educators across the state, that has a couple domains: teaching supports, learning community, job crafting, adult well-being, and program leadership. And, you know, I think a particular emphasis is looking at, in teaching supports, looking at curriculum, getting input from educators and providers around curriculum, child assessment frameworks, classroom materials. Learning community really looks at sort of collaborative professional development, individual access to professional development. So we are really excited about the opportunities of hearing directly from providers through use of this tool, and helping us understand where we need to target more supports, especially for family childcare. I think something that has jumped out to us already is really thinking about I think our field and some of the challenges with curricula being really focused on particular age groups of children, and family childcare providers in our state really having a prevalence of mixed age groups, and, you know, thinking about how is curricula or what kind of professional development would really be supportive to help our childcare providers continue to, you know, to work in those mixed age settings. In the interest of time, I'm going to go a little bit faster here and just say the next two, partnership with our 9 tribal governments, as well as our Baby Promise pilot in rural communities, really go together. So with our money that we received through some childcare discretionary quality dollars, as well as some of our childcare assistance dollars through CCDBG, we started a pilot with some of those funds that we received in 2018 to look at contracted slots plus staff childcare networks and reimbursement rates that were closer to an actual sort of cost of care for infants and toddlers. And we decided to look in communities where we have a childcare, where we have a childcare desert for infants and toddlers. Unfortunately, when we started with the idea of the pilot and we did the work to look at where Oregon was a childcare desert for infants and toddlers, we learned that the entire state is a childcare desert for infants and toddlers. So it certainly has created some more urgency to this work. But what we'll be doing specifically with our 9 federally recognized tribes, we've hired a tribal liaison that's funded out of PDG that will work at the Early Learning Division and will work with a member of a tribal community that will be a quality improvement specialist, and we will expand the pilot. And I think through the pilot, we'll really learn how our tribes want to adjust kind of standards and the current standards that we have to be more culturally responsive in incorporating best practices in their communities for working with infants and toddlers. We're also using our PDG dollars to expand Baby Promise into additional rural communities. So again, I think we're recognizing that as we think about this as a supply building strategy, we need to, continue to expand the pilot. It's currently in 3 communities and 200 slots. So that funding will allow us to do more. And then finally, with our subsidy and our payment rates, we have started a cost of care study in partnership with the Center for American Progress. And right now, Oregon has reimbursement rates through subsidy that are pretty good. Oregon's challenges are really around copays, but at 75% of the market rate, kind of across all provider types, including license exempt providers. But it's really also looking in our grant funded programs. I think we're particularly excited to go back and be able to look at Baby Promise and where we set reimbursement through programs like Preschool Promise and Baby Promise, and see where we align around actual cost of care, because we do build in salary requirements and guidelines into all of our grant funded early care and education investments in the state. But a lot of what we've been basing these off are averages, and I think we have a lot more to learn about whether we are actually reimbursing at the actual cost of care and supporting programs to meet those salary requirements, as well as the other quality supports that they provide to children and families. So with that, I'll stop. Thanks, Rachel.
Thank you, Miriam. Thank you, all of you. If we were in a room together, I know people would be clapping for the incredible amount of expertise and so many ideas. It's hard to even know where to start. We did want to get to a couple of questions that people had asked along the way and make sure they get a chance to get those answered. One of them was going back to Lindsay. We had a couple people who wanted to know a little bit more about your micro grant program and how you are doing that with business partners in your state.
Yeah, so we are partnering with our early childhood councils to roll out those grants. And so they, in partnership with our regulatory licensing team, will help us identify individuals and communities that would make good candidates. Either they're interested in licensing or have submitted their pre-application. And then we'll help, they'll be partners in helping us recruit those individuals.
Great. So we know that other people probably had some questions too. Feel free to put them in the chat box or raise your hand. Danielle can have you talk. One thing that was sort of a little bit of a theme was, how are you funding all these things? I mean, your states that receive the Preschool Development Block Grant dollars, but you're most likely and had to provide state match. So what are some of the other types of resources you're using? Is it quality money from the Child Care Block Grant? Is it, I know Connecticut mentioned they have some philanthropic dollars. Is there anything new and different you're doing that you think people should know about in terms of how you're funding things? It's okay if you say.
Speak for Colorado. The state budget challenges kind of blew up our match. We were using a number of state funds, particularly around home visiting and mental health consultation, to provide for match. And so now we are tapping in more deeply to our philanthropic community to help make up that difference.
Great.
Lindsay, while we have you, just one clarification. I can imagine, as we talked about the PPP grants, which are available to everyone in the country, the micro grants that you're speaking of are for providers within Colorado, correct?
Yes, they're specifically our Colorado providers.
Thanks. Great, that's a good clarification to make. On the other hand, we did have sharing in the chat earlier from the homegrown folks about some other resources available to help people apply for some of the federal dollars that are still not all spent for PPP. So there are some things that are available in any state you're in. I wanted to just stop and see, do we have any other questions coming in from the chat specific for our wonderful panelists? We will give you their contact information if you are still digesting and need need to reach out specifically to one or the other folks on the line. That's one of the things we love about these national webinars, is the chance to connect peers and folks who are just curious what's going on in other states. I feel like that's the #1 question TA providers get, is what are the other states doing around this thing? The paper that we keep referring to will be posted on the Build website right after this, so you can find out more about what other states are doing, or what your state said it was doing with the PDG money. If we don't have any other specific questions, I would like to go back to the let's discuss question, which is one slide before, Danielle. Backwards.
Sorry.
Backwards, yeah. Nope, one more. There we go. Okay. So everyone had so much to share. Well, we did want to end with this sort of reflective conversation, and other people may want to jump in too, but given all the things you've laid out and the challenges that have hit all of our childcare providers since you wrote these plans, you know, are you having any thoughts crystallizing about, like, this is the most important thing we really need to do in terms of building infrastructure as the landscape is changing? Is there anything any of our panelists would like to, you know, add on, reflecting about you're looking forward given what's going on now in your state?
This is Connecticut's Harriet. One thing that we are seeing, and I think other states talk about it quite a bit, is family childcare stayed open during COVID at a greater capacity and rate than some of our center-based. It could be because of group size limitations and so forth, but we actually found that what we thought they would be the most fragile ended up being the ones that were most resilient during COVID. And that was good news for us. And I think it also has helped us better understand that that need is really a family choice as well. And we should really be looking at our supply and demand for family childcare even greater, greater now with post-COVID and reopening. I think we've learned a lot about settings that families prefer, and providers that are able to meet those families where they are.
This is Miriam. I would agree with that. We've been tracking as well. So in Oregon, our governor closed childcare at the end of March and allowed for providers to open as emergency childcare. So individual providers were given the choice about whether to stay open and provide emergency childcare or to close. So as we've looked at the data, we've seen that we've seen that shift. We've had more impact with centers not reopening and staying closed. Now we're going around on 4 months, really, and seeing an increase in sort of family child care. Certainly the ratios and the stable group of 10 is more like normal group size and requirements for family child care than it has been for centers. It's really halved enrollment. I also just wanted to mention that we have also looked at the race and ethnicity and primary languages of our emergency childcare workforce and compared that to some of the data that we had from 2018 to see if we've also been able to maintain sort of the diversity in our workforce through this closure. So I'm happy to share some of those reports. We've also looked at the facilities that have received emergency childcare grants and through some of the CARES Act dollars, and again, the workforce around race, ethnicity, and linguistic diversity. And then I'm happy to share those resources if anybody's interested. And then the last thing I'll say is we continue to hear needs around supplies and continuing to support family childcare providers in particular with access to PPE and cleaning supplies. So we'd had an effort initially at the start of the emergency through our state emergency command center that has wound down. And so I think we're looking at ways to now think about supporting family childcare, but in particular through the duration of sort of childcare coexisting with COVID.
Thank you so much. I'm glad you addressed that issue of the disproportionate impact on providers of color and families and children of color, because of course we're seeing that around the country. And it's one of our questions that we have coming in is around our states tracking that and getting a sense of where the impact has fallen. And I think I've also heard questions about, as the number of slots are smaller, how do you ensure equity and how the limited number of slots are available to whom, and how is that something that people can think about? I think that, Lindsay, did you want to ask Anna anything to this last question? Otherwise, we should respect people's time, but I didn't know you didn't get a chance to respond.
No, I would just echo a lot of what Oregon and Connecticut shared.
Thank you. Well, thank you all so much for your time and sharing your personal perspectives. I bet you're going to get some follow-up. I'm going to turn it back over to Danielle, who will wrap us up.
Thank you, everyone, once again for joining us. We really appreciate it. We appreciate all of your support, as Gina said at the beginning of the series, of today's session, for the whole series. We've listed in the PowerPoint, and the recording will both be available on the Build website. Gina put that link in the chat box, as well as the contact information for all of our speakers today. We will be pausing on this series of home-based childcare webinars for about a month, because we will be launching tomorrow QRIS 2020, which will be an online virtual webinar and meeting series. So we're excited to have that happen and participate if you can. We will come back. We have heard from a few of you with some suggestions for additional topics that you'd like to hear more on regarding home-based childcare. If there's something that's on your mind, please reach out to us at any of the emails for Gina, myself, or info@Build, and we'd love to continue the conversation with you over the next month. In the meantime, have a lovely month of July, and we'll see you in August.